Prostate cancer is the most common cancer among men. Treatment options currently include prostatectomy, chemotherapy, chemical castration, and radiation therapy, but all of these treatments have detrimental long-term effects such as loss of erection, bladder control issues, immunosuppression, and increased chances of other types of cancers. Therefore, active surveillance is a great alternative for low-risk prostate cancer. Low-risk prostate cancer is defined as a Gleason score of 6 or less, PSA less than 10, and a tumor that's either non-palpable or only palpable in less than a half of a lobe of the prostate. Active surveillance requires regular office visits and periodic testing that determines if further intervention is needed, since patients with low prostate cancer often die with prostate cancer rather than because of the prostate cancer. So in this abstract, we measured patient compliance to the National Comprehensive Cancer Network guides for active surveillance by looking at medical records.
Okay, so I'll be talking about the methods section. So as part of the treatment options for prostate cancer study, TOPCS, 221 patients from the Metro Detroit area were newly diagnosed with prostate cancer. They took a survey at baseline, 2-year follow-up, and consented to have their medical records obtained. So at this point, we have 163 medical records reviewed and confirmed to be on active surveillance at the 2-year follow-up. So we compared these records to the National Comprehensive Cancer Network guidelines, NCCN. And then now I'm going to talk about the results. So first, we defined concordant with NCCN guidelines as having greater than or equal to 3 PSA tests and having greater than or equal to 1 prostate biopsy during the 2-year follow-up period. And as you can see in the chart right here, so we found that 55.2% of the patient records were guideline concordant, 11.7% were only concordant with biopsies, 21.5% were only concordant with the PSA, and then 11.7% were discordant for both. So as you can see, patients were significantly more likely to be guideline concordant with PSA testing than guideline concordant with prostate biopsies. And we also include study sample demographics here as well.
So in conclusion, the majority of the active surveillance patients in our sample did follow NCCN guideline during the first 2 years, but within the non-concordant proportion, there was significant variation on how active surveillance was used, which showed that they were not safely practicing active surveillance. And the data showed that patients were more likely to comply with PSA testing rather than prostate biopsy. This could be due to the less invasiveness of prostate biopsy and that it's more convenient just to get blood draws. So this shows that there needs to be improvement in patient and provider education that emphasize the need to safely practice NCCN guidelines if they are to choose to do active surveillance.
Okay, thank you.